Hi, I'm Dr. Felice Gersh, and welcome to my program today on how to lower your risk of stroke. In our previous two episodes on stroke, we covered all the different symptoms, how stroke presents itself. Then we talked in the next episode about what types of people are most at risk, the risk factors. And today we're going to talk about what you can do to take action to lower your risk of stroke for the rest of your life. So I want to just remind you of who I am. I am an integrative women's healthcare specialist. I'm a board certified OBGYN, one of the few in the world who has gone through the fellowship in integrative medicine at the University of Arizona School of Medicine. So I look at women from a very grand scale, not just the female reproductive organs, because I recognize that women are many organs and they work together in a beautiful unison. So I want you to know where I am. Right now, I am sitting in my lovely living room of my hotel near Boston in Massachusetts. So I came here to do some educational programs. Tomorrow, I'm flying off to Toronto, where the following day on Saturday, I'll be doing an entire half-day program on women's health relating to women's brains, women's neurological function, and the central nervous system. Today, I talked here in Boston about the wonderful circadian rhythm, which actually has great relevance in regards to strokes. So let's start with that because it's very fresh on my mind. There is this amazing beauty, this, like I call it, a love affair between women and planet Earth. And they're in like a beautiful dance, kind of like the dance of love, a tango, where the movements of the partners have to be totally in sync so that the dance becomes a beautiful whole. And that is what it is like for women and planet Earth. They are joined, and every single movement of Earth has to match the way the movement of the organ functions in a woman's body should proceed. So it turns out that everything is on a beautiful timer that works in coordination with the 24-hour revolution of Earth. And what does this have to do with strokes, you may be thinking? Well, it turns out that every cell, just about every cell in the body, has its own clock genes. And what happens to women if they're on birth control pills, if they have abnormalities with their detoxification pathways, if they become menopausal and lose their production of estrogen from their ovaries, there is a disconnect between the way that the earth rotates and the way the woman's organs are functioning. Because the master clock of the female body, which is located in the brain atop the optic nerve, does not work properly in the absence of estrogen. It still works, but it's not right. And it turns out that this sets the stage for strokes. Because, as you may know, but I'm not sure if you do, so I want to make sure you do, the vast majority, not all, but the majority of strokes occur in the early morning hours. That is because during the night, what should happen is a woman's blood pressure should drop. Her core body temperature as well should lower. Her pulse should slow, and all the body's rejuvenation and healing processes should be underway. Often in women on birth control pills, in menopause, they don't have this happen at night. Those women are called non-dippers. Their blood pressure does not drop as it should during the night, and that sets the stage for when cortisol, the hormone that helps to wake you up, when that surges in the morning, that can create dysfunction and lead to strokes. It can increase the tension, the constriction of the arteries, and cause rupturing of plaque. So what can we do about that particular aspect? Well, we can't stop menopause. That's going to happen. But we can give women, which are most women, not 100%. So everything has to be individualized. But most women can and really would benefit from going on hormone therapy in menopause. I know that a lot of people have been told that actually hormones do terrible things, that estrogen gives you heart attacks and strokes. That is exactly the opposite. the studies that showed that were not using real hormones. They were using hormones that either came from a horse and they were taken orally, which causes them to become altered, or they were taking chemicals called progestins, which actually are causative of things like cardiovascular disease. So don't be misled by some of the things you've heard. When it's given in a bioidentical transdermal form, estrogen is actually cardio and vascular protective and actually can lower the risk of stroke. And in fact, just a couple of months ago or so, the American Heart Association put on its website, which made me very, very happy, that taking hormones, especially early on in the menopause, starting early, actually is now recognized as being protective. So hooray for that. It's only taken almost 20 years for that turnaround to happen, and it's still in process. Additionally, there are many other things that you can do to try to help maintain a proper circadian rhythm so you don't suffer one of those early morning strokes. One thing is to eat a really healthy diet and eat it in a timed way. So what do I mean by that? Do not eat after 7 o'clock at night, or try really hard not to eat at least after 8 o'clock at night. And definitely don't eat within 2 hours of going to sleep. Those things set the stage for a malfunctioning circadian rhythm. As well, try to not snack. That snacks confuse the way your timing works. The body helps itself, even if you don't have proper estrogen, to know what time it is, to coordinate the organs by the time you eat. But if you eat all the time, they don't know what time it is. So try to eat a good breakfast and one other meal of the day that's good, preferably lunch, but it certainly can be dinner, and then have the other meal be a very light meal, and try not to have snacks. But if you absolutely feel you have to have a snack, try to make it something predominantly fat, such as olives or avocados or nuts, particularly macadamia nuts are really excellent. And it's very good if sometimes you don't eat, if you do what is called periodic fasting or fasting mimicking diet. And that is where you either don't eat for 4 days, once in a while, not all the time, at least 4 times a year, and preferably initially three in a row for 3 months in a row, that you would not eat for either 4 days, or what is much easier, and I prefer, is the fasting mimicking diet that was developed at USC, which is now available as a product. So I would certainly recommend that you do some form of periodic fasting and intermittent fasting in terms of the daytime, where you have prolonged periods, at least 12 hours. Do not eat for 12 hours every night. That is really helpful to lower your risk of stroke. And what else can you do? You can maintain a healthy body weight. Now, I know that's very hard, especially after menopause, but it can be done with actually the things I just mentioned. And if you also eat a lot of plants, it turns out that the bacteria that live in your intestinal tract, what we call your gut microbiome, has a lot to do with every aspect of your health, including your weight and including the health of your arteries. So if you eat a lot of plants, especially a lot of root vegetables, which a lot of people are not aware of, they're not evil, they're actually very good. The starch in them feeds the microbiome. So try to eat at least a cup a day of root vegetables. That would be things like parsnips and rutabagas and beets and turnips and carrots. They are actually very, very good for your gut microbiome. And whole grains, whole meaning they're not milled. So they're not in a powder form, they're not in a flour, they're like in the whole form. So they're eaten like a cereal, kind of like a brown rice would be eaten. That would be things like millet and buckwheat and organic corn. Always eat organic, especially corn, because otherwise it's full of this horrible herbicide called glyphosate. And you can have some brown rice as well. So those are, wonderful to have in reasonable quantities. I wouldn't go extreme. And I recommend, especially if you have high blood pressure, and we'll talk about that more as a huge risk factor, is to try to have 9 or 10 cups of vegetables every day. And it should be 1/3 cruciferous vegetables. And that would be things like broccoli, cauliflower, kale, and radishes and arugula. So Brussels sprouts. So those are the cruciferous vegetables. And 1/3 should be green leafy vegetables, things like all the different kinds of spinaches and the lettuces, and as well like Swiss chard and mustard greens and collard greens, things that you may not eat but are incredibly good for you. They also have the greens like mustard greens and collard greens, dandelion greens, have a lot of very healthy calcium. And calcium is very important, not just for your bones, but for the health of your heart and your arteries. So that's why we want to eat a lot of those leafy greens. And then the other, say, 3 cups would include at least 1 cup of root vegetables and 2 cups of other. Other would be things like garlic and onions and fennel, asparagus, zucchini, things like that, the other vegetables, the squashes. So those would make up your 9 cups of vegetables a day to lower your risk of having a stroke. In terms of sleep, especially if you have a high heart rate, if you have atrial fibrillation for sure, which we talked about somewhat last time, and if you have high blood pressure, be absolutely sure that you get tested for sleep apnea. It turns out that sleep apnea also increases your risk of stroke, and this can be dealt with in a variety of ways. Taking hormones and eating the right diet can be very helpful. And as well, if you get a sleep machine, like a breathing machine, that is virtually 100% effective if you can use it. Not everyone feels comfortable, but it's really worth trying. And then there are dental devices that are very, very good. They work about 80% of the time and can really lower your risk of having a stroke. That is because during the night, when people have sleep apnea, they get insufficient oxygen, which causes their bodies to react by rapidly speeding up their heart rate. And that is what is exactly the opposite. Remember, we talked about during the night, your heart rate should slow. But if you have sleep apnea, your heart rate will speed up. Your sympathetic nervous system will be upregulated. You'll produce more hormones like adrenaline, which will constrict your arteries. So you do not want to have that happen. So sleep apnea, which happens in very significant numbers, like at least half of women, and this is just not being checked enough, half of women in menopause will actually have sleep apnea. If you don't want to do a whole sleep study, you can also do what's called a pulse ox, where you can actually check all night long your oxygenation. And if it's dipping, if your oxygen is going down, and it actually can also check your pulse is going up, your oxygen is going down, then that is a very indicative sign that you have sleep apnea and you have increased risk for a stroke, which of course, as we discussed last time, it can be deadly and otherwise just catastrophic. Smoking is just horrendous for the arteries. So we don't want unhealthy arteries. Remember, a stroke means that you get a blood clot forming. We're talking about ischemic stroke, the ones that involve blood clots, which is the vast majority of strokes. And we'll put the hemorrhagic strokes on the side for the moment. So when you have arteries that are unhealthy, if you have an artery that has plaque building up in it, that of course is a risk factor. And we talked about that you can get a carotid ultrasound to look at the health of your intima, the lining of your artery, to see if it looks healthy or inflamed, because people don't die of plaque. They die of ruptured plaque. So even if you do have plaque, if you stabilize it, it's not a problem. Now, it turns out that in the past, Eskimos never had cardiovascular events. It was almost unheard of. We won't talk about now because now they've been fed the standard American diet and they have the same problems, if not more, as everyone else. But in the past, they ate such a high diet of omega-3, which is a very anti-inflammatory type of fat, okay? That's a polyunsaturated fat, omega-3s. They come from fatty fish. And they ate so much of that even though they developed a lot of plaque, a lot of atherosclerosis, it never ruptured. So having plaque isn't so much the problem. Not that we want it, but that's not really the problem. The problem is if it ruptures. So we have to stabilize it. Omega-3 is one of the most important supplements that you can take. If you have significant plaque, if you have a lot of high blood pressure, I recommend starting off with a very high dose, 4 to 6 grams a day for up to 3-4 months even. And of course, if you have high triglycerides, people stay on 4 grams of omega-3 indefinitely because it really is excellent. There's a lot of studies on omega-3 that it lowers cardiovascular and stroke risk. So that is a mainstay. Of course, you can also eat sardines. I just have so much trouble getting people to eat sardines and wild salmon, but you can't eat wild salmon every day because even though it's one of the lower fishes in terms of mercury, it does have some mercury. So I can't really recommend that you eat it more than about 3 times a week, and that you instead take purified high-grade omega-3 fish oil from fish oil. And I recommend you do fish oil rather than krill. There are some excellent brands of krill, but not too many. And krill is like a little shrimp on the bottom of the ocean. And if it's a wild krill, you're actually destroying the earth, the environment. So we don't want to do that. And if it's a farm krill, then like shrimp, it's usually loaded with things like disinfectant. So, we don't want to have farm krill. We don't want to ever eat farmed shrimp either. And that's one of the dirtiest of all the types of seafood. So we don't want to do that. And we certainly don't want to have that in terms of its oil. So purified fish oil from a high grade. And I personally use the products from Pure Encapsulations. And I really feel that they're good. There are other very excellent fish oils on the market, but you want to know who you're dealing with. Because if you eat rancid oil, rancid fish oil, then it's going to be part of your body. So you want to make sure that you have a really high quality fish oil. There are some other diets that have been advocated to help lower blood pressure because high blood pressure is really at the root of most of the ischemic strokes. So what can we do as far as other diets? Well, I mentioned that I am very in favor of a very high plant-based diet with about 9 or so cups of vegetables a day. Nuts and seeds are wonderful to add, and small amounts of animal protein, with the exception of the very elderly who need more in order to just maintain their muscle mass. So very small amounts of animal that would, of course, not provide too much saturated fat. Now, the DASH diet, you may have heard of it. The DASH diet has a lot of studies showing that it also can lower stroke. And the DASH diet is very similar to the diet I recommend, with the exception that it also recommends adding in low-fat dairy products. So I don't have really a problem if you get the most healthy types of yogurt. The problem is most of the yogurt on the market is really nothing more than processed food from a very bad kind of milk from confined animals who are given chemicals, and they're often on antibiotics. So the only kind of milk you should really ever have is organic, please. But the real best milk we can't really get. It's very difficult. It would be the old-fashioned milk, like straight from the cow, where it's not pasteurized, it's raw, it has all its natural probiotics, and then you ferment it and turn it into yogurt. That would be the healthiest kind of yogurt. It's just very hard to get. But if you can get even organic and you want to have some, I'm not going to object to that. And the DASH diet does seem to work. The other thing that the DASH diet includes, which I also recommend if you have high blood pressure, is to watch your salt intake. A very high salt diet can increase hypertension and increase stroke. And I never want you to eat processed food, which is full of really toxic salt. So if you add a little bit of Himalayan sea salt to your cooking, that's okay. But don't eat processed food. That's where most of the salt is coming from. And that is really, 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 really bad stuff. So do not eat that ever. Another thing that you can do to help control your risk of stroke is to deal with your stress. Stress is quite universal, of course, but we can deal with it in many, many ways. There are breathing exercises, guided imagery, which is my personal favorite. There are relaxation teas and herbals that you can take, like herbal supplements like holy basil and ashwagandha and shishandra and Chinese skullcap. There's others, lemon balm and passion flower, which I love that name. And there are so many relaxation types of herbs, and you can get in supplement form, you can get in tea form. And the other thing of different forms of meditation, the one that's been the most researched is transcendental meditation. There are hundreds of studies on that showing reduction in all sorts of ills, including stroke. But there are others. There's mindfulness type meditation. There's religious meditation. So there's a variety that can work. And some people like things like yoga, which involves a lot of breathing. But hot yoga is different. That's in the form of exercise, which is another thing we're going to talk about now. So after you deal with your stress, and oh, by the way, cognitive behavioral therapy can be amazing. It doesn't change the reality, it changes your perception of reality, which can mean everything for your health, because stress kills. It changes everything. It really constricts your arteries, so you don't want to live in a constant state of stress. And exercise, which I started to mention, is very amazing for lowering your risk of stroke. So of course you're going to do that. In terms of supplements, some of my favorites that can help lower your risk of stroke, in addition to the omega-3s, make sure you have a healthy vitamin D level. I recommend that you keep it in the neighborhood of about 50. As well, some of the other wonderful supplements are green tea, which of course you can drink green tea. If you don't care for the taste of green tea, go with oolong, which is almost as good. That's actually what I like, because for some reason I just haven't really learned to love green tea, but if a lot of my patients really do like it. So if you can drink green tea, try to drink several cups a day of green tea. And if you take a supplement of green tea, be sure you take it with the meal, and don't take more than one a day, because there have been some reports of people taking green tea supplements between meals in large quantities and having some liver toxicity. So beware of that. Another favorite herb is resveratrol, which is actually not specifically an herb, but it's derived from such things as the skin of red grapes. And it's in wine, but please do not drink wine thinking that that's what's going to give you resveratrol. In terms of wine, you have to drink like cases of it, and the alcohol is not good for you. And alcohol actually increases many bad things in your body. So if you have high blood pressure, please stay away from alcohol. If you're healthy, drink very minimally, okay? But do have lots of red grapes, okay? They're great. And in terms of fruit, I love fruit, but I like you to eat about 2 fruit a day, okay? Not as many fruits as vegetables by a long shot. Another type of supplement is berberine, which is an alkaline extract from different plants like Oregon grapefruit. So there's different plants that you can get berberine, and berberine is amazing in many different ways. It helps with glucose regulation. It helps kill bad bacteria and yeast in the gut, and can really be quite significant in helping to lower your risk. CoQ10 can be very helpful for helping you to make energy better. And of course, we all need energy in our hearts to function well. And as well, I love quercetin, which helps to stabilize some of the inflammatory cells of the body. And inflammation is at the root of causing most ills in the body. So you want to test your inflammatory markers. I use the labs from the Cleveland Heart Lab at this time, and they have a wonderful panel of inflammatory markers, so you can know your risk, because inflammation is what causes plaque to rupture. Remember, having plaque is bad enough, but you don't die of plaque, you die of ruptured plaque. So you want to, in summary, eat lots of plants, exercise, and high intensity routine types of exercise where you exercise for just brief periods of time is wonderful. But I always recommend you do that under the guidance of a trained person in sports medicine, in types that they are certified by the American Academy of Sports Medicine, because you can get injured too. So I don't really advocate you go out and start doing high intensity interval training on your own. But if you have no trainer, at least take a brisk walk after every meal for 15-20 minutes, and try to get in your 15,000, or I'll even take 10,000, okay, steps every day. That would be great if you aim for 10,000 steps a day. Go to bed no later than 11, and work on, we'll have to talk more about sleep, but sleep is very important. Get a sleep study, or get your pulse oxygenation checked, your pulse ox checked, to see if your heart rate is going up and your oxygen is going down during the night, because untreated sleep apnea is a huge risk for a stroke. And take a few important supplements so that you can have a healthy body in every which way. So stroke is preventable. Do what you can to be the healthiest you can be. Smile, laugh, and enjoy every day. And this is Felice Gersh saying good night, and I hope to see you soon. I'll be coming back with more programs in the next month, and I hope you'll tune in and join me to learn more about how to stay healthy, happy, and have the best quality life you can possibly have. And have a good night. Thank you.